Hi, my name is Tooley. I am currently a student enrolled in the RN to BSN program at Troy University. Today I will be performing an in-home assessment on my client here who is a 46-year-old male. We will be referring to him as either a male patient or JT for privacy issues. In the home setting, we are in a private setting, so all of our privacy issues are met. We will be lacking a few items such as an ophthalmoscope and an otoscope, and I will refer out when we get to those sections. So we will begin the assessment looking at the general shape of the head, looking for even hair distribution and any lumps noted on the head. And no lumps are noted, and it's even hair distribution. Next, I will be looking at symmetry of the face. I want you to brow your eyebrows together for me. Okay, relax. I want you to smile for me. Okay, relax. Now stick your tongue out for me. Okay, very good. Okay, everything's symmetrical. No deficits noted on either side of the face. I will be palpating. I want you to open your jaw for me. Any pain there? Okay, good. Okay. Pulse is felt. Now I'm going to look at the pupil reaction. So I want you to look straight ahead towards the camera. Okay, pupils are equal and reactive. Okay. Now we're going to do peripheral test. So I want you to cover your right eye for me. With your left eye, I want you to look ahead, and then I want you to tell me when you see my fingers and how many fingers I'm holding up, okay?
2. 1.
No, look straight ahead.
1.
All right. Now I want you to do the same. I want you to cover your left eye for me.
1. 1. 2.
Okay, very good. All right. Peripheral vision isn't intact. Okay, so what I want you to do now, we're going to look at how you follow. So I'm going to I want you to look straight ahead for me. So I'm going to bring my finger up and I want you to follow it out. Follow my finger. Okay. Very good. All normal. Okay. My patient has recently had an eye exam within the last 6 months, and he had 20/20 vision. There was no correction needed at that time, so we're going to forego the Snelling test, but the Snelling test would be if we had the chart at home. I would have him stand 20 feet away, and we would assess for visual acuity. Next thing that we'll begin looking at is his ears. And both symmetrical, no lumps noted. Do you feel any tenderness?
No.
Okay, very good. If I had an otoscope, I would examine for the tympanic, Make sure that it was pearly gray and if there was any internal redness or swelling noted with any drainage. Since we do not have that equipment, we will forego that. Okay. Right now we're going to do a whisper test. So what I'm going to do is I want you to cover, we're going to cup this ear and I'm going to whisper something and you repeat it for me, okay?
Okay. Christmas. New Year.
Okay, very good. Okay, hearing's intact and normal. Okay, next thing I want you to do is I want you to open up. Okay, I want you to stick your tongue out for me. Very good. I'm going to look at the sides. Okay. Very good. Okay. You can put your tongue back. Open up and I want you to look back for me. Okay. Patient is missing one left upper incisor. Tonsils are intact. No swelling noted. No lesions on the sides of the tongue. The gums are pink and intact. No lesions noted there. Patient has no other dental caries noted. No fillings noted. Everything else was in normal limits. Okay. Next thing I want you to do is just relax. I'm going to come in down here. I'm going to start feeling for lymph node swelling. Any tenderness or pain?
No.
Okay. No lumps or tenderness noted. Okay. I want you to push up against my hands. Very good. Normal shoulder strain. Okay. Trachea is midline. Okay, I want you to swallow for me. Okay. Thyroid not detected. No goiters noted. No lumps noted. Okay. All right. Next, I want you to do is I want you to put your hands straight up for me. Okay. And sit a little more forward into the chair for me. And then put your arms behind. Okay, and then make a circle. Okay, very good. Okay, full range of motion in the shoulders. Was there any pain with that range?
No.
With that motion? Okay. Squeeze my hands for me. Okay, very good. Normal strain. Put your hands out. Okay. I want you to just rotate the wrists back and forth. Okay, good. Any pain with rotation?
No.
I want you to flex and extend. Any pain?
No.
Okay, full range of motion in the wrist. Same with the elbows. Extend. Okay, any pain with that? All right, you can have it. Sit back on it. Okay. Let's see your pulses over here. Okay, pulses are 2+. Radio. Pluses and a brachial. Okay, very good. All right. Next thing I'm going to get you to do is I'm going to get you to remove your shirt for me, if you would. Okay. First, I'm going to have you stand for me, if you don't mind. Just stand in that spot. We're going to look at the anterior chest first. Okay, noting that there's symmetry, even hair distribution, skin within normal limits, appropriate for race. There is a mole noted that's right above the right breast areola. Has that changed in any nature,
No.
any color?
No.
How long has it been there?
It's pretty good long time.
Okay. Okay. No change in coloration, no growth? Hasn't gotten any larger?
No.
Okay, very good. Okay. All right. Areola symmetrical. All right. You turn towards the back for me. Okay. Spine aligned. No scoliosis noted. No curvature. Skin's intact. No lesions are noted. No moles are noted. Okay. I'm going to listen to your back while you're standing for me. Slight crackles noted in the upper bases, otherwise every other quadrant was clear. Okay. I want you to repeat the word 99.
99. 99. 99. 99. 99. 99.
Okay, good. Good affirmative, sir. Everything normal? Okay. I'm going to percuss. Slight dullness in the lower lobes, otherwise good, normal everywhere else. Okay, turn around for me. Now I'm going to auscultate the anterior portion of the chest. Just breathe in there. Again, crackles noted in the upper bases, otherwise all other lung fields are clear. I want you to repeat 99 for me.
99. 99. 99. 99. 99. 99.
Okay, very good. Okay, good from just heard. Do you have a chronic cough?
Yes.
Do you smoke?
Yes.
How much do you smoke a day?
Less than a pack.
And how many years have you smoked?
Probably 25.
25 years.
Yeah.
Okay. All right. Let's see for me. Okay. I want you to breathe normally. I'm going to listen to your heart now. I'm going to go into the aortic area. Pulmonary. Verbs point. Tricuspid. Mitral. Okay. Okay. Heart tones are regular with S1, S2, no gallops, no murmurs noted. Point and maximal impulse felt all within normal limits. All right. So what I'm going to get you to do is we're going to lean back in the chair. I'm going to assess your abdomen now. Come up just a little. Just like that. Okay. All right. First, I'm going to start off with auscultation. I'm just going to listen to your stomach, okay? I'm going to listen to all 4 quadrants. Vowel sounds are present, all 4 quadrants. Abdomen is symmetrical and round, with even hair distribution. No lesions are noted. No obvious deformities noted. Okay. So what I'm going to do is I'm going to lightly palpate. I want you to tell me if you feel any tenderness, okay? A little tender there. Okay. Patient is noting some epigastric tenderness. I'm going to percuss. All normal. Now we're going to do some deep palpation. Okay. So you tell me if you feel any discomfort. You feel any?
Still a little tender.
Still a little tender here. Patient has noted to have a duodenal ulcer in the past and is currently being treated with Prevacid. He has also had a EGD and a colonoscopy within the last year, and no new ulcerations or polyps were found. And he will be seen by the gastroenterologist in the next 6 months for a follow-up checkup. Okay. Now I'm going to palpate your liver. Orders noted. Liver normal. And spleen not palpable. Okay, very good. All right. Next, I'm going to assess his femoral pulse. Pulses are 2+ and intact. No masses noted. No lumps noted in the abdomen. Now I'll listen to your carotids before we move down further. No bruise or thrills. I want you to turn your head. Okay. Veins are flat, no distension. And back towards me. Same on this side. No bruise thrills noted in the carotids. Vessels are flat, distended. Okay. Very good. Okay. We are not going to do a male exam at this point, just for privacy, but this 4 to 6 year old man has 3 children, is circumcised, testicles are descended correctly, no lesions noted, and has 3 children, so functioning normally. Okay. Also, I'm going to show you how to do a breast exam on yourself, because males can also acquire breast cancer. So you're going to, once a month, while you're in the shower, check for this area for any lesions or lumps. I'll see that right here. And then also check underneath here for any lumps or tenderness. Does this hurt any? And same thing over here. Assessing and checking yourself for any lumps or tenderness. And none are noted. Any tenderness with that? No. Very good. Okay. All right. Now what I want you to do, just for checking of range of motion of your hips, so I want you to retract that back into you. Yes, very good. Okay, extend out. Same with this left leg. Okay. Any pain or tenderness? No. Okay. I want you to take this leg and cross it over your left leg. Okay. And then same thing with your right. Very good. Okay. Now I want you to take your heel onto the shin and follow it up to your knee. Okay. Back down. The same thing with the opposite. Okay, very good. All right. I want you to flex, extend, and rotate your ankles. Okay, any pain or tenderness noted?
No.
Okay, push against my hands. Very good, normal strength. Okay. You can sit back up for me. Okay. What I want you to do for me now is I want you to stand up. We're going to do the Romberg test. And with your eyes closed, I want you to just stand there. Okay, very good. Normal Romberg test, no fluctuation in stance noted. Okay, now I want you to also bend down and touch your toes for me. Okay, patient able to touch his toes. Very good, have a seat for me. Okay. Now I'm going to have you close your eyes and I'm going to put an item in your hand and I want you to tell me what it is.
Key.
Okay.
Coin.
Very good. Right, this hand.
Coin. Key.
Okay, very good. Okay, keep your eyes closed. And I want you to tell me if it's a light touch or a sharp touch.
Light. Sharp. Light. 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 Sharp. Light. Light. Sharp.
Very good. Sensations are intact. Patient able to identify the objects correctly into his palm of his hands. Everything's normal. All right. I want you to lean back for me one more time. I want you to, we're going to test your Babinski reflex. Okay. Okay. Reflex is intact. Okay. All right, you can sit forward for me. If I had the equipment, I would test his reflexes, starting with his brachial, his wrist, and his knee reflexes, but I do not have that with me at this point. I think we have covered everything we have to do. Do you have any questions for me?
Yeah.
And I would like to thank you for allowing me to perform this assessment on you today.
You're welcome.
Thank you. Have a good day.